Good morning. I'm Paul Irwin, Dean of the School of Public Health here at UAB, and I want to welcome all of you to Celebrating Public Health 2024. Thank you to everyone who is joining us in person and to those joining virtually via Zoom. For the past several years, the UAB School of Public Health has co-hosted an annual event with the Jefferson County Department of Health as part of National Public Health Week, and we are thrilled to continue the tradition. This year's theme of National Public Health Week is Protecting, Connecting, and Thriving. We are all public health. The theme provides an exceptional platform for highlighting the multifaceted nature of public health. It offers a comprehensive framework that illuminates various dimensions of public health, showcasing the significance in diverse contexts. Furthermore, this theme serves as a catalyst for nurturing collaborations and for forging meaningful partnerships, just like we are highlighting today. By emphasizing the interconnectedness of public health issues and the importance of collective action, it encourages stakeholders to unite efforts to addressing health disparities and promoting well-being across the population. This inclusive approach fosters a sense of shared responsibility, empowering individuals and organizations to work together towards achieving common public health goals, just like the School of Public Health has done for many years with the Jefferson County Department of Health. Before I introduce Dr. Hicks, I want to be sure to recognize and welcome two important groups of people. If you are a current JCDH employee, would you please stand or wave? You can also stand and wave. If you are a former JCDH employee or a retiree, yes, please show us the hand and stand, please, and be recognized. Thank you, Dr. Wilson, for joining us. Good to see you back here again. Thank you for all that you have done to all the JCDH employees, both those current employees, former employees, and retired employees. Thank you for all that you have done for Jefferson County and for the state of Alabama. And now I'd like to introduce today's speaker, Dr. David Hicks. Dr. Hicks is a board-certified family medicine physician and serves as health officer at the Jefferson County Department of Health. At JCDH, he previously served as Deputy Health Officer, Incident Commander for JCDH's COVID-19 response efforts, and was Medical Director of Adult Health and Family Planning. Before working for the Health Department, Dr. Hicks oversaw 5 clinic locations as Chief Medical Officer at Birmingham Healthcare. He has also provided medical care in various settings, including urgent care clinics, correctional facilities, and an academic health system. He is a fellow of the American Academy of Family Physicians, chairman of Alabama's STD Medical Advisory Council, and a member of Alabama's Rural Medical Service Awards Advisory Board. Dr. Hicks is a Leadership Birmingham graduate, a Freshwater Land Trust Red Rock Committee member, a Kiwanis Club of Birmingham member, and a UAB School of Public Health's Community Engagement Council Associate. In 2021, he received the NAACP's Metro Birmingham Branch's Community Trailblazer Award. Dr. Hicks earned a Master of Public Health degree in Behavioral and Community Health Sciences at the University of Pittsburgh Graduate School of Public Health and was a National Institutes of Health Minority International Research Training Fogarty trainee at the National University of, if I can turn the page, Science and Technology in Bulawayo, Zimbabwe. He later earned his Doctor of Osteopathic Medicine degree from Rowan Virtua School of Osteopathic Medicine and completed his family medicine residency at Christiana Care Health System, where he also served as chief resident. I'm very honored to introduce him today and welcome him to UAB's campus as part of National Public Health Week. Dr. Hicks.
Good morning, everyone.
Good morning.
I have the distinct privilege to serve as Jefferson County's Health Officer, and I don't take that lightly. But first, I would like to say thank you to Dean Irwin and the UAB School of Public Health that has graciously allowed us this platform to communicate to you what we envision what public health will be moving forward. And also, all the staff at the health department, all the students at UAB School of Public Health, because your dedication and your tireless efforts are what are moving our community forward. So today, the topic is exploring the collective impact of public health in Jefferson County. Collective impact, what does that mean? That's a loaded term. But I'm going to read you a definition, and this comes from the Collective Impact Forum. They modified the definition recently. And collective impact is a network of community members, institutions, organizations that are advancing health equity or equity overall by learning together, aligning and integrating their actions to achieve population and systems level change. I want you to absorb those words. Now, how does that connect with public health conceptually overall? So the World Health Organization has a definition of public health, and these are all the organized measures. That's public, that's private, that prevent disease, promote health, prolong life among the population as a whole. But how do we do that? And that, to me, gets to this concept of collective impact. So let's explore this a little bit further. So I just have to acknowledge I work for a governmental agency, a local health department. And if you see in this schematic, the public health system is bigger, larger, broader than just one singular public health agency. Do you see that all of us working in concert are really what drives the public health system locally, nationally? And so you see representative organizations here. I'm not going to list all of them, but you see schools are there, mental health providers, faith institutions, community health centers, nursing homes, community centers, EMS, hospital systems, nonprofits, elected officials. All of us have a role to play in the overall public health system, not a single governmental agency as public health. But we recognize the role that we as an agency have into leading the conversations, engaging with the communities that we serve. And so with that, I want to take this in another direction. And so imagine if all of us had a crystal ball and we can project and foresee the future. What does the future look like? What should it look like in public health? So let's get our minds wrapped around what that could look like. Now, this actually occurred, so in 2014, so we're going back in time, 10 years ago, there was a group of futurists. They worked for the Institute for Alternative Futures, and they published a report. That report that they published was titled Public Health 2030, a scenario exploration. And this is the approach they did. So these are people that are futurists, visionaries. They said, what do we believe the future is going to look like? So this was going back, think about this, 2014. And they have a process of trying to figure out what that may look like. And they had public health experts around the United States to help inform this process. They got funding from the Kresge Foundation, the Robert Wood Johnson Foundation. And they use this model to try to envision what the future could look like. So let me walk you through that. If you look in the center, that blue zone area you see, it's a zone of conventional expectation. So that is, if things are essentially status quo, this is what public health will look like in 2030. And it can go two different directions. You can see on the upslope, it can go on the successful route, or if there's some failures, it can go on a downward. And so that's essentially extrapolating the current trends at the time in 2014 of what was the most likely or expected future of public health. And then if you look on the bottom, in that bottom part of the chart, it says zone of growing desperation. Doesn't sound too great, does it? The zone of growing desperation represents plausible challenges that could impact public health in a negative way. And they had to project in the future what would happen if almost the worst case happened. And now if you look at the top part, there's zone of high aspiration. And the zone of high aspiration is one of those things that's aspirational. So what if we had a critical mass of stakeholders, you and I, looking and working together under one common vision, common strategy. And we surprised ourselves and we had surprising success. And they divided that up into two different scenarios. They're all positive scenarios, but there's a scenario, they titled scenario 3, and then they had a scenario 4. And depending how things played out in society determines which direction they felt public health was going by the year 2030. So they presented these scenarios to these leading public health experts around the country. And I'm going to walk through the different scenarios, and I want you all to be thinking about what you believe you would have said the future of public health would be. Okay, so here we go. Scenario 1. Now, scenario 1 is in that middle zone, right? If everything was status quo in 2014 moving forward, they called that one step forward and half a step back. So you see, amid continued fiscal constraints, the public health agencies, for example, like the one I work for, and healthcare slowly advance their capabilities. We start using automation, advanced analytics to improve the services that we provide in the communities that we serve in. But they recognize climate change as an issue, and that was going to be a growing issue. And there will be little progress moving the needle on the social determinants of health. But there were great variations in the technological capabilities and funding mechanisms. We had rising healthcare costs, and that would limit the gains that public health would be. So that's scenario 1. So as I'm going through these, think about what you would predict would happen in the future if you were in 2014. So scenario 2, this is on that bottom part of that schematic. This is the one that wasn't so favorable for public health. And scenario 2 is an overwhelmed and under-resourced system. This is the scary proposition. This is funding cuts, hostile political context that undermines public health agencies' roles, having difficulty attracting young talent into the public health workforce and careers. Our public health crises are getting worse. Climate change is having a significant deleterious impact on us. The private sector is moving at their own pace, and there are innovations there. But they're not benefiting those that may need them the most. It's benefiting the affluent communities, the middle-class communities. Those health disparities that we all know worsen, they grow. And then the public health institutions have limited capacity to do anything about it. Is that our future? Is that our current? So now we're going to move into scenario 3, and then we'll go to scenario 4. So remember, scenario 3 and 4 are on that top part of that schematic. This is if things are going the way we really would love them to go. More desirable, okay? This is one called sea change for health equity. So economies are growing. There's quote unquote common sense policies and support for health equity. What does the public health agencies do in this realm? We're using advanced analytics, gamification, diverse partnerships to identify these opportunities, the problems, and we're incentivizing our communities to improve their own health. There's still a recognition that there's going to be health disparities in 2030, but the vast majority are having significant gains, improvement in their health. Housing quality has improved, economic opportunities have improved, education, all the other social determinants of health are improving. Is this our current or our future? So let's go to scenario 4. So this is one that they titled Community-Driven Health and Equity. So the public health agencies, partners, we coalescing our resources, the technologies we have, so that we are maximizing what community health enhancing networks can be. We're exchanging ideas about innovation, best practices. And we're leveraging all the expertise we have. It could be expertise at an academic public health institution. It could be at nonprofits in the community, other governmental agencies. The nation, it says, strives to come to terms with its racial and socioeconomic histories and supports real change and using legislation to provide a more equitable society. You see value shifting here. There's new economic models in the communities. Households are able to sustain themselves. They're able to improve their own health, their own well-being. And then public health traditionally starts shedding some of its functions because it's shifting its role in this scenario from what traditionally has been done to what this new future could be. So, I would like to ask the audience here in this room. You saw scenario 1, 2, 3, and 4. Which do you feel are the most likely scenarios in our future? So, I'm going to ask for show of hands, and for those online, I'll try to project what I believe is what the audience's temperature is on this. So if anybody believes that scenario 1, remember that is essentially the status quo plays out. Raise your hand first. You believe scenario 1 is the more likely scenario. So we have, I would say maybe 1% of the audience is thinking that may be what our future looks like, given the realities. Okay, so let's go to scenario 2. Remember, scenario 2 was the one that was very unfavorable. So show of hands. This is likelihood. This is not what you think you would like to happen. What do you think is the likelihood that scenario 2 is happening or going to happen? Anybody? And so it looks to me about 25% of the room or so or more are saying scenario 2. Okay. All right. Remember, scenario 3 and scenario 4 are the ones that were those aspirational ones. So anybody want to vote for scenario 3? Raise your hand. All right. So it looks like we have maybe about 20%, 30%. Scenario 4. All right. Maybe 15%. Don't quote me on those statistics. It's a rough poll. So the futurists in this study asked that same question of the public health experts around the country in 2014, and this is what they felt. So they felt that scenario 1 was the status quo, was by far the most likely, and then scenario 2 was not too far after that. But preferability, you see a vast majority preferred scenario 3 and scenario 4. Would you all say that you prefer either scenario 3 or scenario 4? I agree. So there's the harsh realities in the system. There's a lot of competing priorities in this system. But can we have a collective impact to move towards scenario 3 or scenario 4? So this is a simple diagram. And I know you may not be able to read the fine print, but let me just walk you through this. On the left side shows what public health and health systems have traditionally focused on, right? And how things have played out in society. So you have fragmentation of our systems. You have unevenly distributed resources. Our data and how we measure data is disparate, not connected. And it says governmental public health agencies lead expansive public health work. We use a biopsychosocial model. We do clinical and tertiary prevention. And on the right side is a potential new future for public health as a field. You see a more concerted effort to support health and wellness and prevention. We're seeing leveraging funds, not just public dollars, but private dollars to help achieve those goals. We have real-time, actionable, and shared data and measurement systems. Ecosystem partners collaborate to generate collective impact. Undergirding all this is equity principles, primary prevention, life course health perspective, using a social ecological model. If we want to see scenario 3 or scenario 4, we have to dramatically change how we have done things in public health as a field and how agencies and organizations do that and do our work together. That collective impact model draws a distinction between collaboration and working collectively to have an impact. See, for collaboration, we can all meet in a room and we can say we're going to work together, and everyone does their part to achieve their own individual goals. But when you have collective impact, that means we're all buying into a common vision. We're all focusing our strategies together. And that is a multiplier. Do we want to be scenario 1 and keep things the same or not? So Deloitte, which a lot of people may be familiar with, did an analysis, and they came up with looking at the future of public health, and they call them 6 mutually reinforcing dimensions of public health. And you can see the similar themes that I just talked about. Ecosystem partners working toward a unified goal. Sounds familiar? Funding and incentives aligning with prevention, health promotion, and wellness. Share data across sectors in real time. Share value proposition. Resilient, robust, multidisciplinary public health workforce, and a future centered around health equity. So let's all think about, is this the future that we want, or do you want the status quo? So remember, I talked about the futurist, and they were looking in the future, and they asked the public health experts around the country what they thought the future would be in 2030. And when everyone said that they wanted scenario 3 or scenario 4 to happen, they came up with some recommendations on how that would look. And there was 4 recommendations, pretty straightforward. So number 1, they said, we recommend that public health agencies transform themselves into health development agencies. with dedicated, sustainable, and sufficient funding. Okay? Recommendation number 2, that we partner in healthcare transformation to facilitate the evolution from a healthcare system to a health system. Recommendation number 3, we need to build the capacity for dialogue about inclusion, opportunity, and equity. And then number 4, we need to have dialogue with other sectors to support innovation. That's what they were saying and recommending in 2014, 10 years ago. If we wanted a future state in 2030 to be scenario 3 or scenario 4. And we're in 2024 right now, and how are we doing? Okay. I love this this chart. This is from the Bay Area Regional Health Inequities Initiative, and this is another way of saying what I've already said before. If you see on the right, there's been a lot of attention traditionally in public health about looking at healthcare outcomes, mortality that people are living with, the diseases that we're trying to impact, behaviors that put us at increased risk. When you look towards the middle, these are getting at the social determinants of health. These are the living conditions that people have, the physical environment, economic and work environment, the service environment, social environment. These are all those drivers that influence those things. And then you have institutional inequities and social inequities. And the shift is, on this schematic you see on the right side, that is what at the time they said was current public health practice. And the left is what the emerging trend across the United States of where public health needs to go towards to address the more upstream, those fundamental root causes of the inequities. That's a tall task if we are working alone and in silos, if we work the same way we've always worked. So what have we done at our local health department? Well, we had a new strategic planning process. We have an adaptive strategic plan. This is a different model than we had in the past. And there's 4 strategic directions in our plan. So if you see at the top right, it says collaborate with community partners to positively influence the determinants of health. Then you see bottom left, focus on health system transformation. Top right, foster a thriving, equitable workplace. And then finally, serve as a trusted source of public health data and information. So, if we at our local health department lean into what our strategic plan is demanding us to be, we can work with all of you all as partners to move towards scenario 3 and scenario 4. We have a role to play, but remember, we're one single agency amongst a broader ecosystem in public health. So, question. I love asking questions, and I love the audience participation, but this is one that you can just keep your answer to yourself. So, what for you does collective impact of public health look like to you? This is your own self-reflective thing. This is about what you personally believe and what personally drives you. This is about what is happening in the organizations that you work in, the communities that you serve. What does that future look like? What can it look like? What do you want it to look like? And people have different visions of what that can look like. And so I can give you an example of collective impact. So I don't know if we have a significant amount of data people that's listening to this talk. So I'll show you this simple little chart. We celebrated our 100-year anniversary a few years ago. And if you look at infant mortality rates in Jefferson County, you see how over almost nearly 100 years, they plummeted. That's a way of looking at collective impact. Because how could that happen if there weren't many foot soldiers doing the work to move the needle on an issue that needed to be addressed? Okay, here's another example. This is syphilis and HIV mortality rates in Jefferson County from 1930 to 2015. You see the trend, significant improvements over time because there was concerted efforts. And I'll give you one more. This is for all my data folks. So tuberculosis crude mortality in Jefferson County from 1916. Pretty impressive, if you want to look at it that way. There's other ways to look at collective impact. Does this look familiar to you? Okay, so I gave you a chart, but this right here is the Red Rock Action Plan. This plan has been a labor of love for many of you in the room to say, what is the future state of what the built infrastructure in Jefferson County needs to look like so we can make green spaces and trail systems more accessible to everyone, not just certain parts of the community. We can have a collective impact that can have permanence for hundreds and hundreds of years. So we've been doing this type of work. But maybe you don't like a map, so I can show you another example of what I may feel as collective impact. All right. What is this? Anyone in the audience? I know I have some environmental health colleagues here. Valley Creek cleanup. So, you have a committee. You have multiple agencies. I'll list a few of them. Stormwater Management Authority, City of Birmingham Stormwater Program, City of Bessemer Stormwater Program, Freshwater Land Trust, Keep Birmingham Beautiful, Alabama Powers Renew Our Rivers, Jefferson County Commission, different municipalities, Jefferson County Department of Health, and many others said, we are going to come together for a common cause because this is a need. And now, as you can see, you can inspire the next generation to take ownership of cleaning up the creek and volunteering right alongside one of our environmental health, public health workers, amongst other people that were doing this. Collective impact. So, think about what is collective impact. Let me read to you that one more time in closing. Collective impact is a network of community members, organizations, and institutions who advance equity by learning together, aligning, and integrating their actions to achieve population and systems level change. So, with that, I want to provide you an example, my final example of collective impact. And I have the honor of recognizing a group of committed individuals who have demonstrated and embodied collective impact. Annually, our health department gives out something called the Public Health Champion Award. We've been doing this for several years. And so I want to announce who the public health champion from the health department is. And I'm going to have a team that represents this larger group to come forward. So hold your applause. This year's 2024 public health champion for Jefferson County is the Overdose Data to Action Regional Task Force. So with that, if I can have the team representing this task force come up, and I want to let you know about this group. A lot of individuals. I'm going to slide over. Y'all come as close as possible. Come in. So right here is acrylic. It says Public Health Champion for Collective Efforts in Response to the Opioid Overdose Crisis, presented to the Overdose Data to Action Regional Task Force, April 2nd, 2024. So if Dr. Travis said, if you can come up and accept this on behalf of the task force. All right. So you can have this, and you can all have a seat, but give this team a round of applause. Thank you. Thank you all. So I'm going to talk a little about who they are, what the task force is, and I want you to think about collective impact and what that looks like. And I'll show you some pictures of what it looks like to me. Okay. So there's a regional task force here of over 100 representatives and agencies and individuals in Jefferson County that have been meeting every month for the past few years, figuring out solutions to tackle the overdose issue. And this team, since 2022, even expanded outside of Jefferson County and involves now a more regional approach in central Alabama. This team has led work to hold community events, multiple media engagements, that could be podcasts, community presentations to address the opioid crisis. There's a lot of partner organizations. I cannot name all of them because I told you there's well over 100 that has been working on this. So imagine if you wanted to provide resources, educational resources, and tangible harm reduction resources to a community. You have to adapt your strategies. You have to get buy-in from stakeholders. You have to have data to drive your decision making. So you have the sheriff's office, police departments, fire, EMS, mental health agencies. You got the health department. You have UAB and different iterations of UAB. There's a lot of other community partners that have working together, community health centers, all working together for this one common purpose. This organization started off at the health department. There was grant funds that were received, but it required partnership. And the individuals that came up are the internal core team at the health department. They're representing the larger collective of over 100 different agencies and groups. So that when you want to talk about saving lives, these individuals are the ones that are saving lives in an emergency department, at a fire station, in a community that has excessive overdoses, organizations and leadership that needs to have that education and information about this. I don't know a better example currently of collective impact that has now gone beyond what's happening just in Jefferson County. But we're providing these resources to the whole state of Alabama because it started off with a seed. A common vision, common purpose, everyone working together, having leadership to corral all the work together. And so when I think of collective impact, this is what I see, okay? It's you all together working in the communities that need the services the most. You having the behind the scenes meetings together. You strategizing, you sharing information and resources. You taking one thing that started off in one small county in Alabama, Jefferson, and now it has regional and statewide influence that's actually saving lives. You know, recently I heard a story Dr. Travis was sharing with me where one of the staff members had provided education in the community, was coming back to the job, came across somebody who appeared to be overdosing right there on the street. They took the training they had that they were training others on and the kit and immediately intervened and saved that person's life. That's collective impact. Those are those thankless acts that happen every day that you all do that give us a chance to live another day, fight another day to tackle these issues together. How can we replicate models like this elsewhere? So that is the challenge, it's a call to action. Let's be introspective, not just collaborate, but collectively work to improve the quality of public health in Jefferson County and beyond. Thank you.
Wow. Wow. Thank you, Dr. Hicks. The School of Public Health looks forward to creating more synergy with the Jefferson County Department of Health, aligning our actions to create those systems change and achieve collective impact. So thank you so much for your inspiration. Congratulations to the Overdose Data and Action Regional Task Force for your recognition, for your award, and most importantly, for your work. Thank you. I want to thank all of our School of Public Health staff and faculty who made all the arrangements for today's event and for the event that follows, particularly the Office of Public Health Practice, our Communications and Marketing team, and our Instructional Technology group. I want to recognize one other group for our partners in the Jefferson County Department of Health who have participated in evidence-based public health training at the School of Public Health. Will you raise your hand? Thank you. And thank you, Dr. Hicks, and thank you, Dr. Wilson, for supporting this, for supporting workforce development that we can be a part of. So thank you again for joining us this morning. Thank you, Dr. Hicks, for your inspiring words.